Hello, I'm Dr. Manish Singhal, medical oncologist at Apollo Hospitals, New Delhi, and we are in March 2019, which is also known as a colon cancer month. By colon, we mean the large intestine, and this large part of the intestines. The colon cancer does appear in the top 10 cancers that India sees, both men and women. However, the incidence of this cancer is still much lesser than what we see in the Western world. The common causes of this particular cancers are genetics, which account for less than 5% of the cases. Alcohol and smoking does account for colon cancer increase in the incidence. And also, eating a lot of junk foods and decreased intake of vegetables and fruits can also increase your chance of having colon cancer. However, in most of the cases, we don't know the cause exactly. The common symptoms of colon cancers are bleeding in the rectum, but mind you, non cancerous benign causes of bleeding are far more common than the cancer causes of bleeding. So don't get alarmed if you have bleeding in the stools or bleeding from through the rectum, but it can be a possible symptom of colon cancer. The other symptoms are irregular bowel habits, that is, alternating diarrhea and constipation. That can be a possible symptom of colon cancer, so be aware. Bloating of the tummy, especially after eating, and bloating during defecation can be a symptom of cancer. A lump or mass in the abdomen, loss of appetite, loss of weight, and fever. These symptoms generally occur when the cancer is already in late stages. Many people are interested to know how we can diagnose this problem in early stages, or is there a blood test or any other test that can be done to detect this problem early. Unfortunately, we don't have any test which can be recommended for routine population to be done early, because this is not a common cancer in our country. However, in Western world, yes, for the general population, a colonoscopy, which is a tube which passes through the rectum with a light and a camera in front of it, which sees the large intestine from inside, can detect this problem at an early stage. And this is recommended in the Western world after the age of 50 years. However, in the Indian population, since the cancer is not so common, there is no such recommendation. But those who have family history of colon cancer, they should check with their physicians whether they need to undergo any screening test, which may be recommended starting from the age of even 20 years, depending on how strong the family history is. Coming to the treatment of colon cancer, the colon cancer treatment is very simple. The mainstay of the treatment is surgery. Fortunately, God has given us good amount of intestine, and we can easily sacrifice half of it or sometimes even full of it. So without having any late symptoms in your life. So the surgery remains the mainstay of the treatment. It is important that some patients after the surgery may require some chemotherapy. About three-fourths of these patients would require some form of chemotherapy to increase the chance of cure. So coming to the survivals of colon cancers, it is about 80% in early stages, but in late stages also, and even in stage 4, which is the final stage of colon cancer, about 25% patients can live forever and get cured of their illness. Not only this, a lot of targeted therapies are now available to increase the chance of cure in these patients, even in late stages. And immunotherapy is a new subject wherein some patients, especially those who have family history, immunotherapy can give a new lease of life for patients of colon cancers, even in advanced stages. With this, I'll close, and I hope you all have very healthy living. Thank you.